Good evening, all. It's Devora Krasnianski from Adai Ad, and once again, I'm really excited to bring to you this next part of our series, "Am I Ready for Marriage?" This series is done together with Mask, and I'm so glad that Ruchama Clapman is here today to talk a little bit about what Mask does for the community. And I'm also very grateful to Hudi for talking about this important topic of how does trauma impact marriage, specifically from the angle before marriage. Of course, there's a lot to talk about how it impacts marriage once we're in a marriage, but for another talk. So let's just jump right in. Ruchama, I'm so grateful once again to have you a part of this. You want to talk a little bit what Mask does?
Yes, hi, good evening, everyone. Thank you, Adai Ad. Thank you, Devora. Thank you, Hudi, for joining in this collaboration of the series that we're offering, which is such an important series. Mask, Mothers and Fathers Aligned Saving Kids. We're there for the parents, for all ages and all stages, for all mental health struggles, including addiction. And we are a referral agency. We offer parent support groups. We have an after-school program. I have a radio show Thursday night on the Zev Brennan line, 6:20 a.m. radio dial. You can catch all our previous shows on our website, maskparents.org. And the goal really is for prevention of any mental health issues or struggle one may have. And when and if you may need a referral for a therapist, not all parents can help their own children, but they do need support and understanding of how to help them. And Mask is not just for young kids, it's for all ages and all stages for all mental health. We have a yeshiva liaison as well. And we're always happy to collaborate with Adai Ad. So thank you for having us. And let's go right to it, Hudi.
Right.
Hey.
So really thank you for this important topic.
Thank you.
This will be available, and this and the rest of the series is available on the Adai Ad website, adaiad.org. And the recording from tonight will also be available, so those who want to unpack it more slowly, because I'm sure we're going to be covering a lot. So, Hudi, what are we talking about? What are we, when we talk about trauma, what are we defining as trauma? What kind of trauma are we talking about?
First of all, again, thank you, Devora, and thank you, Ruchama. Always awe-inspired by the work you're doing, and recently I learned about the work Adai Ad is doing, also very important and life-saving work. So when I started thinking about this topic, this trauma could be very narrowly defined or very broadly defined, and I wanted to, for the purposes of tonight, keep it to a very broad and wide definition. Trauma could be physical trauma, it could be emotional trauma, it could be trauma, generational, transgenerational trauma that's been in our bones, carried on from one generation to the next. Trauma could be attachment trauma, which we're not going to focus on too much, but I'm sure some of it will lead into what we're talking about as well. Trauma could be a breakup on a traumatic breakup on a date. Some therapists, some of us in the lay world as well, like to use capital T trauma and lowercase t trauma. I find that occasionally, it could be very invalidating of someone who experiences what they thought was an uppercase T trauma, and then they hear someone define it as a lowercase t trauma. So trauma is trauma, whether it was abuse, whether it was being a victim of a robbery, or whether it was being in an accident, in a car accident. Trauma is trauma and affects us in many ways, and in similar ways, depending. Very many different traumas affect us in similar ways. And what I think is going to be more important for tonight is sometimes we're not always aware of how our trauma is affecting us until it's time for a new phase of life, which is going to be a big focus of what we're talking about now. So sometimes someone might experience a trauma when they're 5, 6, 7, and then maybe they thought they dealt with it or they forgot about it. And then as they're getting ready for marriage and to enter into a serious relationship, they either get flooded by memories or nightmares or a lot of anxiety about some of that traumatic situation repeating itself. So we're going to try to be as broad as possible.
Okay, great. So how does trauma show up in different people in different ways? How would someone know if they had a situation? How do they know if they are still having it in them. Does that make sense?
Yeah, it makes a lot of sense. And again, every person is different, and there's also universal science of some of these things. Everyone's familiar with. I'm sure most of us are familiar with the Body Keeps the Score book that came out about 10 years ago, maybe more already at this point, from Valdo Koch. I'm talking about how even if we sort of forget about trauma or think we've moved on from a trauma, you know, in our soma, in our bodies, somatically, things will show up, whether it's our legs, our hands, our feet, or even the things we say, or the way we often in the way we react. So if someone, you know, was in a car accident, I've seen a lot of what I'm going to say is based on, you know, clinical examples of things I've seen in my practice, as well as from colleagues. You know, if someone was in a car accident and you know, they sort of get over it, they're ready to move on. They get back into cars and they're fine. And then it comes time for them to be, you know, passenger on a date, let's say, and also they start freaking out because the situation that they're about to get into is something that's similar to the situation that was back then, and it's not even always, they're not even cognizant of it all the time. And so here it is, they start reacting, they start getting a pin in the stomach, their hands start shaking, and they don't know what's wrong. And so, you know, being aware of that trauma is very, you know, very helpful. Obviously, a sexual trauma is a big deal when entering a marriage, because sometimes, again, someone might have been abused, you know, by whatever it was, and then they're coming in, you know, 10, 15 years later into a relationship, and then all of a sudden, again, they get flooded by memories or nightmares and similar kind of symptoms, and they don't know what to do because they've never, you know, they think they dealt with it, or they never did any sort of trauma work, you know, to deal with those things.
So, in what ways does trauma actually impact specifically relationships? Because that's what really the focus of our conversation here.
So what happens very often, again, this is going to touch on attachment, you know, based trauma, which I know is not the main topic, but again, here's the overlap. When we learn to form relationships early on, and you know, as young children, as adolescents, and many times we're not aware of how those relationships are formed or the mechanisms behind those relationships, whether it's the way our parents speak to us, whether it's the way we speak to our siblings, or sometimes communicate with grandparents or other family members, or other people in our life. And what happens is we start getting into more relationships, and very often with peers, especially in our circles, in our communities, a lot of these things aren't so noticeable in the yeshiva kind of setting or in a seminary kind of setting. And it's when we start dating, you know, the opposite gender, that some of these patterns start coming up, and we start, you know, getting to certain patterns that we didn't realize we held on to from our parents or from again, from other people in our lives that form the way we communicate and deal with others, whether it's about secrets, whether it's about, you know, how we communicate about finances, whether it's about how we talk about our day. You know, some of us aren't used to sharing about our day with other people, and they never saw it being modeled growing up, and now, or the days growing up were very traumatic, and they try to forget about it as quickly as possible. And now they're trying to form a relationship with someone through dating and engagement, and the person asks them how the day was, and they have nothing to say. Like, oh, it was fine. So, and then it's like, well, what do you mean it was fine? Like, what happened? What would you speak to? What happened? You know, where'd you go? And that could be seen as an attack. Like, why are you asking me so many questions? I said everything was fine, like nothing happened. And we hold on to these patterns until we realize, you know, until we get sort of mirrored in the relationship and realize that what we're doing is hurting the relationship. You know, it takes time until that happens. Sometimes we don't realize. Sometimes we'll be dating for a long time, and we keep getting rejected. We're a nice person. We get along with people, but then when it comes to getting a little closer and trusting, you know, that completely starts to break down because we don't know what it's like to have that, you know, sprach, or that easy manner with other people.
So with trust is one of the big ones. Is there anything else that where it might show up in a relationship?
Trust is definitely a big one. In general, like when if something is severed early on, or whether it's through a traumatic incident, so to speak, or just from that attachment trauma we're talking about, again, we're not always aware of it. So we go through life, we compensate. We're all very good at compensating, and then we show up for an intimate relationship, and there's certain skills. And this is where, like, knowing the 5 languages, the 5 love languages is very helpful, because we may think we're very, you know, we give a lot of compliments, and we might be dating someone who doesn't like compliments but likes receiving gifts, and we think we're the perfect, you know, partner and the perfect, you know, communicator, but we're not communicating in a way they understand. So so it's not only about trust. It's about learning to listen to other people as well and understanding what their needs are. So, again, many of us grow up in situations where, the parents, again, specifically, are controlling or invalidating of feelings or thoughts. And, a kid will say, oh, I had a hard day. And the parent will be like, oh, no, you didn't have a hard day. Like, what was so bad, And then they carry that with them. And then we're getting into a different relationship. And it's like, oh, you don't really feel that. You don't really think that. And the other partner is very hurt because they're, what do you mean? Or they start to doubt themselves. And I think I'm being a good listener by modeling what I've heard my whole life. And really, I'm just throwing arrows at the relationship because the communication is getting severed. So again, learning to listen is a big one. And there's another one that's hypervigilance. So many of us who experience a traumatic incident become very hypervigilant, and we're not aware of it. We want to know what's going on all the time around us. We're checking our surroundings. This is true for a lot of people who've either been abused or have been in traumatic incidents, whether it's fires or other kinds of scary situations, and checking fire alarms a lot, checking locks a lot, kind of anxious kind of behavior that for them was always coping and made a lot of sense, but the other person never saw. So it's like, well, why you were so worried about? It's like, no, I'm not so worried. Like, bad things happen. And again, it's that conversation about being able to realize where the trauma is showing up in the body or just in our actions even.
So someone wrote in that he was a chayal, for example. So he has a lot of trauma, or he's not sure if he has trauma because he can function very well during the days. Is something that he should be concerned about, something that he should be doing now?
That's a great question. What's actually interesting, you talk about a chayal, a soldier. My first interview I had for my internship when I was in grad school back in the day was at a hospital that serviced many veterans. This is U.S. veterans. And I walked into the psychologist's office, which is a funny story itself, because when I got there, she asked me what I was doing there. I was like, I came for an interview. She's like, no, I don't have you on my calendar for today. So she made a mistake. But anyway, I survived. So see, it was a little trauma right there. But she then went and asked me, said, what do you do? She said, I just come from a meeting with a soldier. And she says, what do you do when someone tells you that they can't sleep at night because they killed a child in Vietnam or, in a war? And I was trying to be, all smart. I think of something I'd read in a book or heard from a teacher. Like, I hadn't worked at all. And, she saw me kind of fumbling. And she's like, sometimes you don't do anything. Sometimes you just listen and learn to be a good listener. And while it's very important to listen to others, like I mentioned before, and we'll talk more about later, listening to ourselves is even more important and knowing what we need and how we need it. So for someone who's been in the Army, again, every soldier is different. Every armed forces is different. When you're in that setting of being a soldier, there's a camaraderie, there's a unity. The guys, this is true for our fellow members also, or people in the fire department. You talk about it, you shake it out. There's a way of dealing with it. That's in the immediate aftermath of things. But then comes the long-term PTSD. So there's acute stress, traumatic disorder, and then there's post-traumatic stress disorder, which shows up much later, which is going to be very different. And we'll talk more about that also. And those are some of the flashbacks, the nightmares, the being afraid of being triggered every time you see a child because you remember, someone who died, or being afraid to make friends because your three best friends all got shot up, on an ambush gone wrong. And it's like, what do I do? So first is listening to ourselves. What do we need? How do we need it? Then it's learning to trust, usually it's going to be a therapist, but it could sometimes be someone through the Army. It could be going back to an old general or someone and talking about it and sharing and getting that support from those people who've been in the same situation. And then noticing how it comes up and then being, again, that awareness is huge. So, and here's a big difference between going through trauma and having PTSD. Not everyone who experiences a trauma has post-traumatic stress disorder. I don't have the definition pulled up in front of me, but you can find it online what PTSD is. Versus having, again, like I said, having a trauma. So for someone who's really having symptoms of PTSD, seeking therapy, finding a therapist who's trained to treat PTSD and is trauma informed, whether it's using EMDR or somatic-based intervention or just has good skills in dealing with trauma, that's usually going to be the best step, as well as finding support, whether it's support groups of soldiers or other people, victims of abuse or whatever the trauma is. That's also usually a big step in the process. Again, it's not necessary for everybody, but usually very helpful, because most likely it's going to show up in the relationship at some point.
That was going to be my question. That is, if it's everything seems fine and he can deal with work and everything else, it's not quite the same as being in a marriage relationship. So it's worth getting that support and working through it, whatever it is. Is that what you're saying?
100%. I worked with somebody once whose spouse had told them that they sleep like a Holocaust survivor. This wasn't a Holocaust survivor. Someone was born many years after a Holocaust survivor, but they were never aware of it. They just slept. They flashed around. They didn't think it was anything. They thought maybe that's the way people slept until they're in a relationship and someone's like, "Well, you don't sleep at night. You make a lot of noise and you move around and crashing around like someone here." And and that person had experienced a traumatic event, and here it was showing up in a way that they weren't even aware of it. So these kind of things happen, all the time. That being said, there are people who experience trauma who doesn't show up, and they may not show up, and they might be functional fine. They still may benefit from therapy or from support, and they might not need that intense work. It's going to depend very much on how it's coming up and how it's affecting your functioning. So
then that question leads to, how do I know if I did go through something that is traumatic, whether it's big T, little t, doesn't matter. Like you said, it's really in the perception of the person who had it, not what's defined by other people. How does someone know that they've worked through it enough, whether with a therapist or sometimes, like I heard you that you can actually go work through it without a therapist? There are other ways to work through it. So how do we know if we're ready to get into a relationship?
Well, there's a few things. First of all, is if someone's clearly presenting with symptoms of PTSD, whether having the flashbacks, the nightmares, the hypervigilance all the time, and they're tuned into themselves and they're aware of it. That's a sign of non-functioning. Two is an awareness, and this is again the difference between attachment trauma and event trauma, we'll call it, where a person clearly can know there's a difference. There's a before and after. If until they were 16 years old, everything was hunky dory, and then at 16 they were in a suicide, bombing attack, God forbid, and then they can't sleep, or they're very, wound up, so to speak. Then that's a sign something's wrong, right? I used to sleep fine at night, now I can't sleep. What's going on? There's a trauma. Okay, how do I deal with that? How do I work on that, right? So that's one. And two is having people in your life who you trust and who love you that say, hey, you're not the same. Something's up. Something's wrong. And this brings us into another topic of trauma, which is grief and bereavement. But these kind of questions come up a lot. And there's a huge difference between grief and bereavement and depression. And sometimes it looks the same, and sometimes people will, when someone has gone through a grief or a traumatic loss, and people say, get over it, move past it, they'd want you to be happy. There's all kinds of things. I'm sure we could have a whole webinar just on the well-meaning things people say after someone experiences a loss. But that's actually the body grieving in a way that's healthy. And I was reading recently Hope Edelman, and she talks about how she's been doing a lot of grief work over the last 20, 30 years. And she says how she's a lot more concerned about the people who don't 10, 15, 20 years after a trauma or after a loss, don't tear up or don't have, all of a sudden a memory coming out of nowhere of someone, of their lost loved one, as opposed to people who just tough it up and sort of ignore what's going on, where eventually it's going to show up and come out at some point, and it's going to cause a lot more damage then, as opposed to having this grief process slowly work through. And every person is different, every situation is different, and every age group is different. So sometimes you have a kid who the day after Shiva will, in 6th, 7th, 8th grade, want to go back to school and be with his friends and sort of forget about it. That's great. And sometimes you have a kid who for 3 months is having a really hard time getting to school. And that's also okay. And again, that has to be dealt with by people who are in the know and could help a kid transition back to school, because, obviously not good for kids to stay home. But those feelings have to be honored, and that grief has to be processed. Because if we just shove them back in and say, tough it up, a lot is going to get lost.
Right. So someone who's functioning well, goes to work and does well on his teams or her teams and whatever, but never really addressed it in any real setting, should they assume that they're going to be fine, or should they assume that they should run it through a therapist to see if they're fine, or should they definitely go to a therapist? How do we look at that?
I always shy away from giving complete black and white absolute answers. My hunch is that if someone's been through something that they think might be a trauma, going to a therapist would probably be helpful, at least for an evaluation. Say, hey, I don't know if I need this. This is what happened. I don't think it's affecting me, or that it might be affecting me in X, Y, and Z. I'm getting married in 3 months, or my boyfriend, girlfriend, whatever, is going to propose to me next week. And it's on the back of my mind, maybe we could talk about it. And, if the therapist is skilled and knowledgeable, and they know what to ask and how to ask, that will give a lot of information. Again, like I said before, not everyone experiences trauma the same way. Not everyone suffers from a traumatic incident the same way, and not everyone experiences the same thing as trauma. You have people who, I had this with people who were 9/11 and the World Trade Center. Some of them were very quickly able to go back, work in other, skyscrapers, tall buildings, go on the train, kind of work and move through it in one way. And some of them have not been able to enter skyscrapers since then. And they're both valid and fair. And there's no absolute right answer. It's being honest with yourself, though, knowing how it's affecting you and how it may show up. And what's tricky about marriage for many people, and maybe we'll touch on another subset of this later, is they've never been married before, so they don't know what's going to come up, how it's going to show up, and where it's going to show up. And this comes into also, if it shows up early on in the marriage, getting the help then, and not calling the whole thing over.
Right, or not just pushing it off because this will figure itself out. We're going to stay to the pre-marriage, because definitely there's a lot when this actually shows up. But now we're talking about theoretically how to prepare ourselves for a successful marriage, which is different than being in a successful marriage. So, I guess, what if someone were to go to therapy? They had some sort of trauma, they know it, and they're functioning well enough. What types of different trauma therapies can work in this situation?
So I'm a believer, and I should have said this early on. Everything I say is my opinion. So don't take anything I say as absolute word. If I think there's so many Jewish therapists, and started by, modern psychotherapy was started by a Jewish guy, and I think there's so many from therapists, is because everyone knows 2 Jews, 3 opinions. So I think when it comes to therapists, it's 10 times that. 2 therapists, 15 opinions. Psychoanalysis, DBT. Somatic work,
Hudi A and Hudi B.
Talk.
Your right? 2 opinions. Go ahead.
So every therapist is going to be of 2 minds about something, and till infinity, right? So every modality, therapy itself, psychotherapy, and every modality was made up by human beings, right? So we're not talking about something that came from a higher power, or however well it's researched or it's designed. They're all made up by people, and many of them, this is not true for all of them, were made up by people who, for whatever reason, other therapies weren't working, and then they needed a new kind of therapy that worked for them. Some of them were discovered by accident, some of them were discovered because, for different reasons, based on research. But every therapist is going to be practicing the same kind of therapy differently. So if you have 2, somatic therapists, they're going to be doing something very different. 2 DBT therapists are going to do something different, and even EMDR, 2 EMDR therapists, you could do. It could be the tone of voice, the rate of speech, whatever it is. There's always going to be, every therapy is different. And even in the manualized treatment, so to speak, and even if you're following a protocol in CBT for panic disorder, it's going to be different based on the therapist. So with that intro A, intro B is that, is again, every therapy has pros and cons, and may work for a lot of people with the same issues, and they may not work for someone else. So just because you've been to a therapist doesn't mean your options are exhausted. And just because you've been to a specific kind of therapist, it doesn't mean that that modality doesn't work either, right? I've had this with many clients, and I'm sure there's clients who I've seen have gone to other therapists and said the same thing. So it's an endless cycle. That being said, there are modalities of treatment designed to treat trauma. EMDR is obviously big. I'm not trained in EMDR, and there's somatic intervention and sensory motor psychotherapy, which I am trained in level 1 in sensory motor, which uses what we talked about before, using some of the things that get trapped in the body, and it releases some of that, because the mind and the body are connected. So even if we forget or dissociate, our body is holding on to it. Whether it's our physical body or even our cognitive body, so to speak, is holding on to things that we may not be aware of. There's therapeutic, there's art therapy designed for trauma. There's trauma-focused CBT. There's DBT PE, prolonged exposure. And many, many other modalities. Some I've always surprised. There's always many I haven't heard of, and there's many I've forgotten. So, if you try one modality, it works great. If you try one modality, it doesn't work, try something else. There's something out there. And I'm going to go a little further off the what I was saying before, is that trauma and working through trauma has existed before psychotherapy. So, for those of us who, have the tradition of the Torah, there's many traumas in the Torah, traumatic incidents, whether it's being sold by your brothers as a slave, whether it's the death of children, whatever it is, it's kind of all there already from Aaron Cohen to Yosef, Avram Avinu having to send away a child, but, whatever kind of thing, it's all there. And there was no therapy, right? So, and we find these characters working through these things, and we find it, lahavdil, so to speak, in literature, whether it's Shakespeare or other, works of poetry or literature, that throughout the ages, there's characters struggling with melancholy, with depression, with traumatic events, and finding solace in different things, whether it's nature, whether it's friendship, whether it's meaningful projects, or whether it's finding meaning in the suffering. And something works and something doesn't work later on. It's about being flexible and open to new things, which is something that's hard after we've experienced the trauma, and it's possible.
Okay. So if someone chooses to go to a therapist, should it be someone who has trained in some style of some modality that's with trauma, or can a more GP, was not a GP, a general therapist or an individual therapist? And a little bit of a flip of this, I know, could this be addressed as a couple? I know that right now we're talking about dating, but I'm just very curious. Can this be done in couples therapy because of the role of the supporting spouse?
Yeah, so we'll talk about that in a second, because premarital couples counseling is a thing, and it's becoming more of a thing in the religious world as well. I think I'm not, I've only been in the field about 10 years, and there's people who've been doing this 20, 30, 40 years. And they'll probably tell you there's been a big shift. I think until about maybe 20 years ago, you went to a therapist. Some maybe specialize in children, some maybe in adults, some maybe in couples, but there wasn't a lot of, even though there were modalities that were being practiced, there wasn't a ton of specialties. Whereas now there's so many different specialties and subcategories and level 1, 2, and 3s and subcat, and sub things, within those. So if someone's looking for something specific, they'll find someone. So if someone was in an accident and they were recommended to go to an EMDR therapist, there's no reason not to go to an EMDR therapist if that's what they're told. If someone's, struggling with an eating disorder, and then they're told to go to an eating disorder specialist, it would probably make a lot more sense than going to someone who's not trained specifically in eating disorders. That being said, someone who's a well-skilled and well-balanced therapist will do one of two things: either be able to adapt whatever it is they're doing to that disorder, or refer them out if it's something that they realize that's beyond the scope of their practice. And that's what most competent therapists would do. So while it would help to find specific modalities, sometimes different things come up over therapy that require different skill sets. This is common. I do a lot of DBT work, and a lot of, not everyone, but a lot of folks who require DBT skills also have a trauma history, but they're very often referred for DBT first because they're just not functioning. They're not communicating. They're very dysregulated. They may be engaging in self-harm. So the DBT skills often come first, and then some of the deeper trauma work. But a lot of this is newer kind of stuff that 15, 20 years ago, a lot of this was getting done together and also well. But now we have more tools and more research on kind of how to space it apart a little better.
So what I'm understanding then is that you could start, first of all, get a referral. So if you would talk to, let's say, someone like Ruchama Clapman.
Talk to Mask, yes.
You can actually talk about what is going on for you, and she can actually help you find, or someone else who knows the different modalities and different therapists who can help you find the right person to talk to, rather than just going to, this person's a great therapist and everyone goes to him or her, and it may not be necessarily someone who works a lot with trauma. So,
and if I could just add, what works for one person just may not work for another. So even if your sister-in-law or your brother-in-law went to see somebody and it really worked for them, whatever one story is may be totally different and may not work for them.
Right.
Exactly.
Hudi, when we were talking about this talk, you started talking about intergenerational trauma
Hmm.
and how it shows up in our from world. So can you just define that and just talk about what that means and how it shows up?
Yeah. So again, this is going to again touch on the attachment and that kind of stuff. So I'm going to try to be mindful of that, but it's all fair game, right?
Right.
So I've personally done a lot of research on intergenerational effects of trauma, specifically the Holocaust, which has led me to research to on people from Darfur or other modern atrocities or things going on. And we're going to see a whole new, unfortunately, well, it's not like we're saying now we're going to see a whole new generation of this with what's going on now in the world. Of people who've been experienced being refugees or prisoners of war or victims of just mass killings or mass events like this. And there's two ways. There's actually more than two ways the trauma gets passed down, but there's a couple of things that happen. One is through the telling of stories. So I'm sure there's some people on who have parents or grandparents or great grandparents who were Holocaust survivors who told a story, especially at specific times of the year. I met someone who was a child of survivors, and he said every single Shabbos meal, every Yontif meal ended in a camp at the ghetto. That's just, it's going to come up. And again, that may have totally different effects on two people. I know a lot of children of survivors and grandchildren now, and some are very affected by what they heard about, and it shapes their worldview, whether they're very scared of the world or they're very active in the world and trying to do what now is called tikkun olam, but work on trying to understand people better and work towards a greater good, or hide from the world and they're very scared of the world. So even those two similar incidents show very differently. And then there's survivors who didn't talk about it at all. And Eva Hoffman, I think her name is, also a child of survivors who's done a lot of writing on this, writes about how sometimes that trauma is even worse because children know their parents went through something, but they don't know what it was. And even though someone who hears about it doesn't know what it was either because they didn't experience it, they at least have some words or images to go with it. But someone who knows that their parents went through something like the Holocaust, they have no way. So they're just in this kind of dark, empty space that's atrocious, which it was and it is. But they don't have the kalim, so to speak, to even to handle it. So and that gets passed down. So there was one survivor I met who said how she would take her children out when it was cold without a coat, or in the rain, because you have to learn how to deal with the elements, which again sounds very smart and teaching your kids to cope, but the effect that's going to have on the future generations is what we've seen is usually not great, because you're raising children with a lot of anxiety and post-traumatic fear. And within our DNA, again, as Jews, we've been persecuted for, whether it was in Spain during the Inquisition, during the pogroms, obviously the Holocaust, and we're always on the run, and that mindset still is with us now. So there's some of that, even if we're not the children or grandchildren of Holocaust survivors, there's some of that in our blood from some point. If we came to America, in the early 1900s or late 1800s, and keeping Shabbos was a big deal, or staying from was a big deal, or being worried about anti-Semitism in Europe. All these things play an effect, and there's and a lot of marriages, and this comes to the premarital thing, where a lot of couples are still introduced this way, not just in the Chassidish world where there's bishos and the couple doesn't mean it at all, but even in the more modern circles where people are still introduced, a lot of it's like, who's your family, what do the fathers do, what do the mothers do, what countries. I mean, again, some of this is going a little bit out of style, but what towns were they from in Europe, what countries were they from, what Hasidus are they from, or are they affiliated with? So these kind of things that exist all over the world and in many different cultures, but I think are more pronounced in the Orthodox world, and sometimes have effects that we're not aware of, again, until we're married. I have a few couples I'm working with now who I get off like we're a mixed marriage, and even on the outside they look very similar and they talk very similar, but one comes from a very Hungarian kind of background and had that kind of upbringing, and the other one's coming from a more Litvish upbringing or a more Yakish upbringing, and then it's like, and we're not always aware of what these subtle differences are until it comes to raising kids or whatever it is. Again, we're going further ahead, but these things are all linked together.
A totally different question. If someone had sexual abuse, so that's definitely a trauma, how might that show up? And piggybacking off that is, On the 3, people say that if someone was sexually abused as a child, they're likely to do that again. So I just want to, now that we're talking about, what are your thoughts on that?
So it's 3. I'm going to break it, even though it's 2 questions, I'm going to break it down to 3. One thing I've seen, and I'm sure many other therapists could say this and did some research on this, we're talking about attachment trauma a little bit. Again, it's going to be a topic for another day. Tune in for that. I don't have the info, but send out the info for the attachment trauma one. And event, we're calling it event trauma for now. Many times, not always, again, there's no hard facts, but many times those 2 go together. So many people, for whatever reason, have some sort of attachment trauma. The bonds with the parents or others are very severely, are either severed or severely fraying, fall into, whether it's behaviorally or emotionally, cognitively, whatever it is, fall into places where it's easier for them to become susceptible to other forms of trauma. In this case, we're talking about sexual abuse. So I just want to link those 2 at this point, which is important for treatment, because it could be two very different things that have to then be rectified or worked on or worked through to have a successful marriage. So sexual abuse is going to come up in many different ways, both before and after marriage, and this is probably majority of the trauma that I'm dealing with as a therapist, and many of my colleagues are as well. So one is the hypervigilance and the PTSD symptoms. So that's it for many victims, not all, there's no all. For many, forming relationships is harder, especially if the perpetrator, I'm going female to male here, or male to female, was of the opposite gender. Trusting someone of the opposite gender could be very challenging. And forming an intimate connection with them could be very challenging. How do you trust somebody, and then how do you talk to them, and how do you get over that? So, and even once that's solved, then there's a physical component. Once it comes to having a physical relationship with someone, it's a whole new can of worms that, again, many people didn't experience from the time they suffered the abuse, whatever age it was, till the marriage. They weren't asked to, be in that kind of connection, that kind of relationship with somebody in a physical way. And now all of a sudden, coming up something that shows up as physical pain, that's very common, where, again, women and sometimes men will have physical sensations of pain. And more often than not, just a fear of intimacy that shows up as a very difficult time in those moments, which is a whole nother thing to unpack. So it shows up a lot, and it's going to show up again probably more frequently after marriage, but early signs before marriage are going to be some of that, what we talked about before. The intimacy and the trust might be very compromised or very difficult if someone's experienced that kind of abuse. So
someone who has some sexual abuse in their past should really work through that before marriage. It's not something, because it could, even though they could be functioning quite well with their friends and at work, there's a whole other element that's not in their purview right now, because they're not married. There was no physical connection. So it's worth working it through, or at least if you think you worked it through, just confirm that you worked it through, because you could be very, very well functioning outside of a marriage.
Exactly, and this is also a little tricky to tease apart, but they might be functioning very well within the marriage. They might be great cooks. They might be able to have a good time on the outside, take care of children, deal with brothers-in-law, sisters-in-law, in-laws, Yom Tovim, do all that kind of stuff, especially if there's no attachment trauma. But when it comes to intimacy, it might be very challenging. There might be a whole different kind of, a different ballgame.
Right. And so what's the point the second
part
of the
that,
question, right?
Mm-hmm.
People say that if someone was sexually abused, they will likely do that to somebody else. Is there any truth to that?
So I just heard the numbers, and I totally lost them. Wait, I'm just having, okay, sorry. There was Shani Virtualizer is doing great work, and crunching a lot of those numbers and putting the data together. But there's no have to. There is a likelihood. There's an increased likelihood of someone being a repeat offender. But what's very promising is that if those individuals get treatment, especially if they get it early on, the likelihood of repeating the offense, it goes down in the 90%. So we're not talking about generally a very high number of instances, but again, there is that likelihood, and it should be addressed. That being said, if someone was abused and has no inkling or has ever moved towards doing any of that kind of behavior, there's no reason to assume that they will at some point down the line.
Okay. So then,
But this
for
goes
me-
back to what I said before about prevention and just being aware and you know, having open conversation.
and actually working through it, because it's there. You can't just wish it away. It doesn't just go away.
Correct. Right. It just gets under the rug and the rug gets piled higher and higher.
Okay, so we're talking about all of it about preparing for marriage, getting therapy alone. We're not talking about the premarital piece.
Correct.
And now, so someone feels like they're ready enough to date. They feel, and the therapist or whoever they're working with, and now they're dating. So how do they share about whatever happened? So let's try to role play a little bit of what could be happening in their date, because if they don't share it, that's omission, lying by omission, and possibly betrayal. So let's talk to that.
Sure. So this is a big one, and this comes up again. Also, could be related to what we're talking about. Also, sharing about if someone's on medication, and that comes up a lot, and that can also be a trauma in itself, going on psychiatric meds and things like that. But to stick on this topic, again, with wisdom, with if someone's dating semi-seriously or very seriously, and they trust a person, that means that they've already had conversations that have been vulnerable and open, and have had a chance to fail. Because if there's no chance of success, there's no chance to fail. So if someone's dating, you know, in some circles that could be a third date, in some circles that could be a third month, in some circles that could be a third year. But if someone's dating very seriously and they have that open connection with somebody, at a certain point, there's when things get more serious and a proposal might be on the horizon, it's like, okay, there's still, that has to be clear. And how much is shared, you know, is very dependent on different cases and different circumstances, different people. Sometimes in the presence of a therapist would be helpful. Sometimes in the presence of someone else would be helpful. Sometimes, more often than not, it's not going to be the presence of anyone else. But it's introduced softly, and hopefully the receiving partner is in a place of trust and goodwill with the other person, where we hear something, we don't become interrogators. Who, what, when, where, you know, how, you know, we thank someone for sharing. We ask them, you know, how they're feeling about sharing it. Is there anything that they could do to support them now? And at some point, you know, to inquire and find out if they've spoken about with the therapist, if their parents know, et cetera, and having a more open, broad conversation, but to stay away from interrogating or you know, or freaking out, because that would end up, you know, putting someone else in a very precarious situation, and less likely to share if there's more to share, or in the future if anything happens. You know, if they get attacked and the relationship does go on, but something else happens down the line, whatever it is, even if it's someone who lost car keys, but they know that when there's something, you know, at stake, that is you know, they get that resistance, it could you know, really set the relationship down a slippery slope. So that takes wisdom in the hands of the receiver, which not everyone has. But like I said, hopefully if someone has that relationship already, there's the tools and the means are already there, already in place.
That's some of the work that I do as a dating coach, is actually help someone who has a story to share, figure out how and where and how much to, like I call it to drip a little bit, and then share and see how the person responds before they share everything, if they don't feel comfortable sharing the whole story. And on this, so I think it's important to actually work with somebody because you know your story, whatever the story is. So it's important to work with somebody. And then on the flip, I also work with other people when someone has shared something and they choose not to share it with their family, which is, I think there's a lot of validity to that thought process of not sharing with your family, because they will always be looking at that person, looking out for little clues. So you talk to someone who's a little more objective, like myself as a coach or a therapist, or somebody who's a step removed, and to talk about how do you feel about that, and what to do with the new information, and what more information do you need to know in order to make that decision. So I think that,
process it, yeah.
But many times if one is dripping the information, it doesn't come as a complete shock. So the other one has a sense of that there's something big that's going to be shared. So I think that it's important to know how to share, whether it's a trauma or For some people, it's a debt or medication or whatever it is. It's your story, so you know to share it.
Yeah, and this again leads into something else we had discussed on Sunday together was these other kinds of traumas or difficulties that people experience throughout their upbringing that are very that they feel very shamed about, and it's not always what other people might see as capital T trauma, whether it's frequent moving, whether it's one parent or both parents having jobs that they don't consider to be with it, or having a financially not doing well, or not having a good place in society, or being from a single parent home, or having a parent in jail, or there's many kind of things that could lead to shame, and that might be very difficult to share, and someone might have an inkling of before a date, but when it comes to getting closer to a marriage, that are going to play a much bigger role. It's like, what are we going to do at a wedding if everyone knows someone's dad is in jail? What are we going to do if everyone knows that, whatever it is, So that's these things are all very important, and that's part of a trusting relationship.
And so someone asked a question, does 12 steps help with trauma?
What's specifically, any kind of trauma or just in general?
Well, let's answer it in general, if it's the right kind of.
Yeah. Well, addictions is a whole nother topic related to this one as well. So again, there's no general answer. Many people who suffer from some sort of addiction, and there's many kinds of 12-step programs. But the two most basic are AA, Alcoholics Anonymous, and Narcotics Anonymous. And then there's SA and many others, like gambling. So first of all, it's important. It's not to judge, and not to be that investigator, but to kind of be curious about what it is that may have led to addiction in the first place. If it was sometimes it's a trauma, sometimes it's not. So not jumping to a conclusion, but also being curious about it. And 12 steps is another fantastic tool that some people find that works, and some people don't. And some people do some steps, some people do step work without doing all the steps. Some people are very into it. They have sponsors to go to meetings daily or multiple times a week. It really is very dependent on the person. And just because someone suffered from an addiction and now is in recovery and didn't do 12 steps doesn't mean that they're not in recovery. And just because someone was in addiction and still goes to 12-step meetings daily doesn't mean they're an active addiction, right? It means that they take their recovery very seriously, and going to the meetings is a very important part of their recovery process. So again, there's no blanket rule, and there's many 12-step programs, like we said. So it's, again, being curious and open to what it is, what function the 12-step program is serving, and do they have support outside the 12-step program? Some people do, some people don't. That might be a big factor, especially if you're going to be moving. If someone's living in a place where they have a meeting they've been going to for 5-10 years, and now they're moving to another country or another part of the country, do they still have access, or do they still need it? And they might not know if they need it for a few months. And it could be because of the marriage and new stress, they might actually need it more than they realized before. And that doesn't mean the marriage isn't working. It just means that they need that support or that environment to succeed. Mm-hmm. So, just being the awareness of that is super important.
Okay, another question came in. I can't tell if it's a he or she, but a trauma of their own divorce. What kind of support, what kind of work should they work through, and how will they know if they're ready to get into a marriage?
I feel like this should be giving you ideas for another webinar. This could be a whole other webinar.
It is, but let's just do the one on one foot.
Yeah. So because we're going super broad tonight, and we're kind of lumping many different traumas together, again, and each one is very different and deserves its own time and attention and space. The rules we're kind of laying out for other things are going to apply for divorce. Someone either has a trauma history, doesn't get married, and goes through the trauma of getting divorced. Even a good divorce is traumatic and painful, in the best of circumstances, right? And we all know stories of divorces that aren't good and amicable. So, again, having support, speaking to other people, whether it's men or women, or who have been divorced and gotten remarried, finding out what that process is like. Dating, I like to use divorce word, dripping. Maybe a casual date, maybe having a go-between, maybe having a shotgun, kind of, especially at the beginning, or maybe ditching a shotgun because the shotgun was what got you into trouble in the first place. But doing it on your own terms and slowly, and not rushing into things. And again, here, two very different camps. some people never make the same mistake twice. They whatever went wrong, and now they go 180 degrees the other way. And some people end up repeating the same mistake again. They fall for someone that's not good for them or unhealthy, or they think they're going to change, or et cetera, et cetera, et cetera. And then they're down a slippery slope. So how do we, again, tune to ourselves, seek support from a therapist and from those who we trust and in our life to kind of help figure out what's going on for ourselves and not make the same mistake twice, or make it work this time, if that's what's going to take, and knowing that ahead of time. So again, there's no one size fits all, but just viewing it the way we've been talking about everything else is know yourself. That's step one, know yourself, and then know what you're dealing with.
So what I'm hearing throughout everything is that just because someone had a trauma, whether it's a known trauma or something they didn't know, doesn't mean that they will necessarily have problems in their marriage, especially if they've worked through it. So it's worth at least speaking to somebody and seeing how you work through it, and being open always to work through if something starts appearing in the marriage. So just because, for example, some people say, oh, if they come from such a family that had this trauma, well, I don't want to even go there, but it's so ridiculous because people have worked through it. They probably have good skills, better skills than somebody who didn't necessarily have anything that brought them to get the skills. So just because, divorce, death, jail, whatever it is, doesn't mean that there's the trauma impacted them necessarily negatively forever. If they didn't get the support, then maybe they ought to get that support before. But don't dismiss the whole shidduch that way.
And this is frustrating. This frustrates everyone, including therapists. You have people in the same family, whether it's siblings or even sometimes twins, who experience the same loss and go on very different paths. Some function well, build lives, start again and go on, and some get very stuck. And there's no perfect data on why that happens or how that happens. There's lots of studies of resiliency and post-traumatic growth, but no one factor, as far as I've seen in the research, accounts for 100% of the cases. So because someone had a trauma in a family, or because someone experienced something in their family, it doesn't mean that they're all doomed. But it would be helpful to find out what's going on and what's going on with certain siblings and what's going on. Just to trust blindly is also not gonna, might not be so wise.
Right. So the idea that if you know that somebody had a trauma means that you know what you can be talking about on a date, but not to just dismiss the whole wonderful person because their a parent passed or abandoned them, but there's all attachment is not necessarily event trauma, which thanks for that distinction. But even if somebody went through a war or lost their house or watched their house burn down, which is more event.
I want to just, again, for the broader conversation, we're talking about attachment trauma and event trauma, but if someone's in an experience of attachment trauma or in a setting of attachment trauma, and there's one time where the parent does something to them that's part of the attachment trauma issue, that's still an event. So attachment trauma is a lot of trauma. So again, this is why it's confusing.
So I'm trying to distinct it very much from like a fire is not really an attachment. This is not necessarily, depends how, of course, everything else. But if they watch their house burn down and everything burned down, that's not necessarily an attachment. It's more
correct.
So just that they're two different things, and just because someone went through something traumatic, now especially like something like a fire, which a lot of the community would know about, then you know what to talk about. And you have a conversation and see how that impacted them. It doesn't mean that they are traumatized for life. They're probably stronger for it if they went through the support.
Correct. There's a great question just came out, so popped up on the chat. Do we still have time? How are we doing with time?
Yeah, go ahead, and then final thoughts. This will be the last.
This is from Chaya, and this comes up a lot. Religious trauma, and here again, religious trauma is very different for different people. It's very often different for men and women. Also for people went through a yeshiva system or people went through a day school system, and it's tricky because I enjoy this kind of work. Some therapists don't. Besides for being trained, in as a therapist in different modalities, I also did a year of, for lack of a better word, hashkafa call, where I unpacked a lot of hashkafa questions, the Ian, so to speak, and the way people learn Gemara, and a lot of these topics came up. So I kind of enjoy that kind of stuff. But again, to stick to what we've been talking about. Understanding how our views of things could change, and many of the times that what people phrase as religion is not religion, is their own trauma and their own sort of, unprocessed, so to speak, garbage that they're dealing with, that they lump onto religion. So whether it's an OCD, whether it's anxiety, or whether it's trauma they have from their parents or their upbringing, and it takes work and it takes effort to tease that apart. It's like, this is not religion. This is my rabbi, father, mother's, grandfather's mishigas, right? And it's nothing to do with the religion. But that takes, again, effort and work and really introspection. And it could be dealt with, and it could be addressed. And many of these things also don't come up till we're married. And this happens a lot with couples, again, not the main topic of tonight, but of interfaith couples, where there's two people from different faiths, and they think that, something doesn't mean anything to them until they're married. They're like, oh, of course we're gonna have a menorah in our house. Or a couple that grew up Hasidish, then they don't necessarily identify as Hasidish anymore. And then they have a child, they're like, oh, of course we're gonna speak Yiddish to the kid, because the kid has to know Yiddish. And the other one's like, no, we're not speaking Yiddish. That's only those people speak Yiddish. So these are a lot of things that sometimes take time till they show up, but again, should be and could be dealt with pre-marriage to kind of those, what I like to call the flashing yellow lights on the dashboard, so you kind of know what's going on underneath the hood as the journey continues.
Okay, we are running down to the hour. Final thoughts, and then we'll see if any other questions come in after that.
Final thoughts. I have a lot of final thoughts. First of all, again, thank you. This is really wonderful and opened a whole, bunch of other topics that are ripe for discussion and relevant and applicable, to everything going on now. So thank you for, having me. I guess the few takeaways, things that we've been talking about the whole time is first of all, check in with yourself, be honest. It's very hard, especially for people who've been through a trauma, try to find someone who you trust, or at least a few people you trust for different things. So there might be someone who you trust to talk about your parents and not about an incident that happened to you. There might be someone who you trust to talk about an event that may have happened that you have suspicion about, but not about your other things going on, and that's fine. But finding those people, even we have to use the word drips, in pockets, is helpful. People could mirror back and see what's going on and give you reflection. Therapists are trained to do that. Try to find a therapist. Some people have trauma therapy, another kind of therapy to talk about for another time, and that could affect someone going through a marriage as well. So we'll save that one. But know yourself, and then know what you're dealing with. Be open, be curious. I had training once when I was interning at a hospital. They said, don't ignore, explore. So if you see something, be open to it. Don't judge. Find out if you have a question that you don't feel comfortable asking the person you're dating. Ask your own rabbi, your own mentor, mashpia, mashkiach, somebody you could trust. Ask an online forum, but don't take the answer seriously. And then continue to explore, because in general in life, we want to explore. The more open and curious we are to experiences, the world is round, and what's round and is alive and keeps going. When we get stuck in a square, things get stuck in the corners and there's no growth. So as soon as we think we know something, we're stuck. So keep going, keep exploring yourself and others, and build a great relationships. Yeah.
Right. And I just want to add to that. I think that's really a great way of wrapping it up. Just want to add to that. Don't not share it on a date. Like, it's the whole not sharing, the betrayal that comes from not sharing, the unknowns is really not a good way to start a relationship. So I just wanted to throw that piece in also, because I see that coming up a lot. And people are like, do I have to share? Yeah, you do. I mean, you don't have to share every single detail. It's your story. You know what you have to share, but to have something like that spring up on somebody adds a whole new layer of betrayal, which is then they'll have betrayal trauma, and we'll start a whole new cycle.
A whole nother
talk.
I'd like to thank you, Hudi, very much.
Thank you.
And I just want to add that anybody that wants to reach Hudi, call Mask, and we will help you get to Hudi. 718-758-0400, or for a trauma therapist, EMDR, whatever it is, feel free to call. It's confidential. You can call every day from 10 a.m. to 10 p.m. Thank you, Devora.
Thank you so much, Ruchama. Thank you so much, Hudi. If anyone has any other questions on this topic or anything else related to am I ready for marriage or marriage itself, definitely reach out to Adai Ad, info@adaiad.org, or if you want to use the anonymous, but meaning that if you don't give us your contact information, we can't really help you. You can do that as well as on the website. There were some other questions that came in that were related more to after the marriage has started, and we will address that in another talk. But if you did send in a question, without sending in your contact information, we can't get back to you. So you can send in the question again. So thank you so much, Ruchama. Thank you so much, Hudi, and thank you all for joining us. And good night.
Thank you.